Awesome. Well, welcome everyone to another Lunch with a Boxer series here at Pacific University. Today we're going to hear and be going over a little bit about the Health and Counseling Office. So we're super happy that they've joined us. For those who don't know me yet, I'm Gracie. I'm one of the admissions counselors here at Pacific. I'll be helping host today's session. If you have any questions, feel free to drop them in the chat. You can also send them to the entire group or directly to me. I'll ensure that all of the questions are addressed throughout the session or after we meet. For your awareness and privacy, today's session will be recorded, so we are requesting that all participants just turn off their camera while they're listening. If you're watching this at a later time, the recording will be posted on YouTube. So if you have any additional questions, don't worry. We can always email you, or we can always connect you with your admissions counselor if you just send us a quick email. We'll ensure that the correct person from our team follows up with you to provide everything that you need. We want to make sure that you get all the options and information that you're looking for. Before we dive into learning about the amazing Health and Counseling Center, I know many of you have questions about financial aid, so we wanted to provide a quick update from our awesome financial aid office. I'd like to introduce Debbie O'Day, our financial aid director from the financial aid office. Debbie, thank you so much for your time. I'm passing the mic over to you for a quick update, and then we'll get started with health and counseling.
Thank you so much, Gracie. Hi, everybody. I'm Debbie O'Day. I'm the director here at Pacific University, director of financial aid. I'm not the director of everything. You don't want me to be the director of everything. I know that this cycle, for those of you who are trying to go get ready for your freshman year of college, you've never had to deal with financial aid before. So this has been a terrible introduction. I really hope that this is the worst year that you have in dealing with the FAFSA hiccups and issues. I really hope after this year, it's going to be so smooth and like it can only go up from here. I should be careful how I say that, but we know that it's been stressful for students and families. It's been stressful for us just not having the answers to give you guys because we know that this is a huge part of your decision-making process. If you've been paying attention to what the Department of Education has been putting out, it's been a big adventure. Thankfully, they have been really listening to what a lot of those of us in the financial aid offices are saying as we have been testing and getting these files in. We've been giving feedback to the Department of Education about issues that we're finding, things that are broken. They've been very responsive in taking that feedback and making adjustments. And last week, they were able to finally give us some updated lists of students who had been identified as having problems with, not from the students' fault, but on the Department of Education, they're processing, identified with problems that we know we're going to have to wait for them to fix. But then they were able, some of the students in those populations, to give us lists saying, we've identified these students as not having any issues, you can proceed. So with that green light, our office has started sending out financial aid letters. We are kind of moving through them in batches as we are getting waves of batches from the Department of Education. So yesterday was our first batch of letters that went out. If you're local to Forest Grove, you're probably going to get that in the next day or two, just because the Postal Service is pretty quick. If you're a little farther out, it might take a couple of days. You should get by the end of this week. If you were in that first group that went out, you'll get an email also letting you know that your package is out there. You'll be able to log into your student account and review that as well. If you don't get that email by the end of the week, odds are you're in that next batch that we're working on now. And every couple of days, we will send a new batch and then send a corresponding email. So keep an eye out for that. Even if you haven't gotten an email, I know that admissions did send out an email earlier this week, just reminding everybody how to access their student account. I would really encourage you to just go ahead and make sure that's set up now and start poking around in there, because odds are you might click right at the right time when that gets turned on and you'll be able to see it before you even get your letter in the mail. So keep an eye on that. Once you get it, if you have any questions, you can feel free to email us or call us. We have two fabulous undergraduate admissions counselors, Stacy England and Griffin Shawless, and they can navigate you through the entire process. If you have additional questions or if you have additional circumstances that you want us to consider, then we'll walk you through how to submit that documentation to us and what next steps are going to look like. Anything else that you're wondering about how the money piece works, about how the cost works, please don't hesitate to reach out. Our incredible admission staff obviously knows a ton about that as well. But if you just want to like really drill down a little more into the financial aid piece, we are available. We also don't close over the summer. People always ask, what do you do for summer break? I don't have summer break. I am here for you all because we are getting ready for our class to come in the fall. So please feel free to reach out, ask us any questions, even if you just want to open up that line of communication, say, hey, this is who I am. I wanted to know who my financial aid counselor was. We are more than happy to chat with you and make sure that you understand everything that you're looking at so that you can make all the decisions that you need to. So thank you so much, Gracie, for letting me pop in here. My email address is super easy. It's debbie@pacificu.edu. If you have questions for me, or if you want to email the financial aid office, it's financialaid@pacificu.edu. We will be happy to help you with anything you need to know. All right.
Awesome. Thank you so much, Debbie, for your
Yeah.
valuable time and insight. This is a great update and some good news at this time.
Yes.
We greatly appreciate you and all the
Of course.
support your team is doing for students. So I'll let you hop off now, but
Okay.
huge thank you.
Thank you all. Bye-bye.
And for those who are joining us or watching the recording, if you have any questions for Debbie or the financial aid office, we'll make sure that we get you in contact with your financial aid advisors if you have any follow-up questions. But now with that, let's get started and start learning about our wonderful Health and Counseling Center. And then we'll have a Q&A following the presentation. So if you have any questions, feel free to drop them in the chat, send me a direct message, and we'll get some questions answered. So it's a joy to introduce Graham, our mental health promotions and prevention specialist, and Perla, the director of our student health center. Thank you, Graham and Perla, for joining us. I can't wait to hear.
Wonderful. Thank you, Gracie. Hello, everyone. I'm going to go ahead and I'm going to share a presentation that Pearl and I have done before as well. So we hope we'll cover all the bases. If you have questions that come up, please don't hesitate to ask. I also want to introduce as well, AJ and Nikki are two of our graduate level trainees here at the Counseling Center. We'll talk a little bit more about Counseling Center services, but they're also able to answer questions as well. So, but we'll go ahead and we'll dive in. Let me share my screen. Make sure it's working. You should be able to see a slide that says Student Employee Health Center staff. Can we all see it?
Yeah.
All right, Perla, go ahead.
Well, thank you for having us. My name is Perla and I'm the director of the Student Health Center. And this is our staff. We have one physician assistant, an MD, 3 medical assistants, and 2 front office coordinators. I am also a medical assistant myself, so sometimes you might see me running around the clinic, rooming patients. We are very happy to have an MD. Not very many student health centers have an MD, and we have Dr. Melanie Doak, who has over 20 years of internal medicine experience. Also, 2 years ago, we hired Kaylee Barfield, our PA. She did her fellowship here at the Pacific Interprofessional Clinic, and she was doing her fellowship as a behavioral health specialist. And so we're just happy to have her and have those resources here also available at the health center.
Unfortunately, the training pictures are not included here, but this is the central team here at the Counseling Center. You see Director Dr. Laura Stallings, who's also the Dean of Student Wellbeing, Keiko Aoyagi, Jamie Young, Amanda Guerrero, our staff psychologists. Angela Surratt is our clinic coordinator, and then that's me down there in the, what is that? Right-hand corner. On average, we have our training cohorts range from anywhere from 5 to just 1 student. They come from a mix of graduate programs, primarily the School of Graduate Psychology here at Pacific, which is in Hillsborough, and then Lewis and Clark, which is another similarly sized institutions in Portland. Okay.
Some of the services that we offer here at the health center is the same services that you will see at any primary care office. We do annual exams. We do treat anxiety, depression, contraception, just your cold, flu symptoms, allergies. So any infections, ear, UTIs, upper respiratory infections. We have a very limited selection of immunization. So if you need your flu vaccine, we have it available. Unfortunately, we do not have COVID vaccines, and that's not something that we will be getting. But we do have some basic immunizations here at the health center. If there's any services that you might need and they're not listed, just give us a call and we can tell you if we treat it or not, but mainly because we do have an MD here in the office, we do see pretty much everything. We also bill insurance. We're one of the few health centers that have implemented this practice. So some of the insurances that we bill are Aetna, Cigna, First Choice Health. So they're listed on our website. If you don't see your insurance listed, then that means we're not participating providers. That doesn't mean that you're not able to get services here, but you will have higher out-of-pocket costs. One thing that I do like to mention is that if you decide to take the Aetna student insurance, there are no copays when you come to the health center, and also there are no out-of-pocket cost or deductible doesn't apply. The only thing is the labs and x-rays that would get billed through the facility, which we don't do here, so there would be an expense for labs or x-rays. Our hours, we are open year-round, but we do have summer hours that are limited. We are only open 3 days a week here in Forest Grove during the summer and 2 days a week in Hillsborough. We are here on campus right next to the beautiful admissions office on College Way. And we're only 2 blocks from the Hillsborough campus on Oak Street. Sorry, I'm looking at it on Oak Street. We do share locations with the counseling center. We do work together very often, but we are a HIPAA clinic. They are a remind me, Graham.
So the counseling center, the records there are contained under FERPA, which is basically the educational equivalent of HIPAA.
Yeah, so even though we work together about patients, we do have to get both consent signs. So your information would never be shared with your teachers, with your coaches. We don't share it unless you give us permission.
I'm going to talk a little bit about the counseling center services as well. So Pacific is proud of the fact that we have if you look at the kind of ratio of counselors to students, we have a higher than average ratio of counselors to students. We provide consultation to students and campus members as well, and we provide short-term counseling to students. It's available free of charge to all students as long as they are within the state of Oregon at the time of the session, which has a whole bunch to do with like licensure and laws and things like that. I will repeat what Perla was saying of the information that's happens in counseling is confidential. We can, and I imagine it's probably mostly parents who might be viewing this, but students as well. We can breach folks' confidentiality if there are concerns about like safety or things like that. But in general, all of the information shared in a counseling session remains confidential. Sometimes students are worried that we'll talk to other folks on campus, as Perla was mentioning. And if students want us to do that connecting, we're more than happy to, but we don't do it by default. Partly because the confidentiality is one of the key cornerstones of what makes counseling effective. Myself and the clinicians also do a fair amount of community engagement and training. That looks like suicide prevention training, workshops with different classes, going in to specifically talk about like how to cope with stress or manage anxiety, things like that. We also run support groups and workshops, which include things like we do a series, or we've actually broken it down into one session. It's called Mindful Coping that teaches foundational mindfulness skills. We also have Wise Minds, which is kind of building emotional resilience, which we find students really like. We also provide urgent walk-in, noon to 1. And this is students can access this either in person in both Hillsborough and Forest Grove or via teletherapy. All of our services are available in person or via teletherapy. The urgent walk-in provides space and time for folks who might not have had time to establish care with a counseling center, but are needing to check in with a mental health care provider. We work very closely both with the Student Employee Health Center and also our Office of Student Support, which works to support students who need a little bit more access to resources and things like that. For parents and for students, parents and students can both file care referrals about themselves or have parents file them about their children after you arrive on campus. We provide a 24/7 support and crisis line that's available. The folks who respond to those calls are all licensed mental health care providers. And for students who eventually like study abroad and things like that, this number is actually available internationally 24 hours a day, 365 days a year. The contact us for a free and confidential consultation. We don't start any of the services until students have arrived on campus. And if you have questions about counseling services, or if your student is curious about certain things, you're more than welcome to reach out to us. I always feel like this is awkward because I'm like, here is our social media. Part of my job as the promotion and prevention specialist to be like, social media is not great for our mental health, but follow us on Instagram. So there you go. It's a little bit of a mixed message. Yeah, and if folks have questions, we're happy to help. One thing that I would share with you folks is if your student, or if you're a student and listening and you're taking really kind of any medication, but in particular any kind of psychotropic or mental health medication, is to ensure that your prescription is transferred before you arrive. Sometimes that can take a little bit of extra time. I would initiate that transfer a month before your arrival. Our closest fillable pharmacy for those kind of meds is the Safeway, which is a couple of blocks off of campus here in Forest Grove. Here we go. If you have a phone and would like to scan this QR code, it will take you right to our Instagram. I will say for parents, one thing that we encourage parents is to follow as well, because we share a fair amount of the programming that we do. So it can be helpful to direct students towards events and things like that, which can provide a really unique opportunity for them to like engage with their community. One thing we have coming up is Reading Day, which it's the day between after the end of finals, or after the end of classes and the beginning of finals. And we have this spring, we're bringing a llama to campus. We're going to have like cotton candy and popcorn. In the fall, we've been bringing baby goats to say hello. So students seem to enjoy that, and they deserve a break. I think that is the end of our information today. I'm also thinking about, I'm going to stop sharing. And it sounds like this information will all be available to you through other means, but also just one thing that a question that comes up really frequently is like, where is the nearest urgent care? Where is the nearest hospital? There's an urgent care just like a minute or two off of campus. The nearest hospital is in Hillsborough. It's the Perlitz, the Tuolity.
The Hillsborough OHSU Hillsborough Medical Center.
Thank you.
And there is a resource guide now in our website that will tell you all the closest hospitals and urgent cares with address, hours, and phone numbers. And I can share that link on chat in just a little bit.
Awesome. Thank you, Perla. And just in case folks are curious, transport to Hillsborough with lights on, if you were in an ambulance or things like that, is it's actually under 10 minutes. So it's close and quite accessible. That is our like primary sharing. We're happy to answer questions here if folks have questions, and yeah.
I did want to add when Graham mentioned medication management or transferring your prescriptions, we also do medication management. So if you are receiving a special medication from your primary care doctor at home, we will need records sent to us and we can continue to prescribe that medication. We just need to meet the student for a quick appointment and discuss it with the doctor. But that way, instead of having your prescription mailed to you and running the risk of being delayed, we can manage that for you.
Awesome. Thank you both so much. That was super helpful and informational. Thank you for your time and the amazing work that you're doing to support students. I just have a couple of questions, and then if there are any follow-up questions that we get after today's session, I'll definitely get them to you. But let's start. So having these resources on campus is it's phenomenal for students to be able to reach so accessibly. When the office is closed on the weekends, where would you direct students for care?
Urgent care or emergency room. So on the link, I just put a few examples of where to go. Okay, if I scratch my finger, well, maybe I'll just go get a Band-Aid. If I feel like I broke something, that's an emergency room visit. So it's a very detailed guide. But you can always contact CPS, Campus Public Safety, and they can direct you. Unfortunately, we don't have after hours coverage.
Thank you so much. And we'll make sure that link is shared as well on the YouTube recording. So that's perfect. Thank you.
And Oh,
Yeah,
sorry.
and then Graham, exactly,
No,
perfect.
for mental health concerns, we do have the 24/7 line, which it feeds back into our counseling center system, which allows us to do that wraparound care. I would also highlight for folks at the bottom of every single Pacific web page is a button that says support and safety. If you press that button, it leads you to a list of all of the resources that are available. We've actually gotten feedback. We're working on like curating it a little bit because it's a lot. There are a lot of resources available, so that's also a primary place I would direct folks to.
Thank you. And then another question that you might have covered, but just to reiterate, do you folks offer flu shots?
We do, starting in September until we run out.
Thank you. And then let's see. And then you said the closest pharmacy is Safeway to campus, correct? And that's just a quick walk or a quick drive.
Yes, and there's actually free public transportation right behind the Student and Employee Health Center and Counseling Center office on Main Street. We have the Grove Link, and so it's just a free public transportation that drives through Safeway and other parts of downtown Forest Grove.
And then I think my last question for you, Graham, possibly is there a limit to number of times that a student can visit the Health and Counseling Center?
That's an excellent question. To be quite frank, there are limits and there are not. And this is one of the things that for folks who've encountered mental health care systems before, there are gray areas inside of the services that we provide. The reason that we do a short-term model, which typically ends at about 10 sessions, is to allow us to see as many students as possible. A consistent concern that occurs in university counseling centers is that there can be a wait list that is months long. We're pretty proud of the fact that we only occasionally have a wait list, and we work really hard to make sure that everyone's being seen in a timely manner. So if a student's kind of coming in and what they're bringing in suggests that they might be looking to connect to longer term care, then their clinician will work with them to establish outside care. And it's very important to say it very clearly of no one would ever like come in and be like told no, especially if there was an urgent or crisis situation and be like, no, you can't, you've used up your punch card. Like it does not work that way. And it is a short-term model, partly because like if we look at the data for students who come to counseling, the average number of sessions is about 6, because most students are dealing with like high stress finals, transitions, like moving away from home, homesickness, things like that, and lots of other concerns as well. So I apologize for the kind of gray answer, but I'm like yes and no.
No, super informational. Thank you. That's perfect.
I just wanted to add one more thing that we found, it's very important. If you're covered under your parents' insurance, please make sure it is a comparable plan to what you, or what the university offers. You are required to have health insurance when you come to campus. The link I share has a very detailed guide, but we don't want you to be surprised when you come to campus. So this guide, we're very proud of it because it explains step by step and what you need to have. Unfortunately, the university will reject if you have an HMO plan or an out-of-state Medicaid. So make sure that you review the pros and cons of not taking the university health plan that is offered through the Aetna health plan, because we don't want you to have any out-of-pocket expenses when you come to campus, or if you have any emergencies, if you're on rotations, we want to make sure that you are covered at all times. So I really want to make sure that you review the link that I sent with all the pros and cons of either like taking the insurance or waiving it. Please, if you have questions, feel free to email me.
And
Thank
just to note, the Aetna plan that Perla is describing, the school provided plan, if your student does enroll in the Aetna plan, they have mental health professionals as well, who they can provide referrals, and they also provide teletherapy, just to put it out there.
Super helpful info. Well, so much for your time today, the amazing work that you're doing to support our students. For folks who are joining us on the recording, please feel free to email me any additional more questions. And if you're on YouTube today and you're watching this and you found it helpful, feel free to send us a message or any questions that you might have. I'm going to stop the recording now. Thank you both again so much and wishing you all the best today.
Thank you.
Thank you.